I'd like to introduce, and would you give a please warm welcome to our health spokesman, Louise Bours, MEP.
Good morning, everybody. Good morning. Goodness, you make me proud to be a member of this party every time I come and speak somewhere. Thank you so much for being so warm and welcoming. Thank you. UKIP believes in the NHS. We and the British people are fully committed to looking after the NHS. And the vast majority of people working within the NHS are committed to looking after the British people. The founding of the National Health Service in 1948 was a victory for the people of Britain. Quality healthcare, free at the point of delivery, funded entirely from taxation, meaning that people paid into it according to their means for the benefit of everybody. But 60 years on, it's the NHS itself that needs nursing back to health, mainly because it has become a political punch bag. Dysfunctional targets are imposed and dropped depending on what looks good for the government of the day. Endless top-down reorganisations that drain it of cash take place not because of clinical need, but political opportunism. Money is pumped into NHS management with high executive salaries, repayments for the hastily signed PFI contract, and policies of uncontrolled mass immigration pile on the pressure. Patient care suffers. The establishment parties have stolen. They have stolen the NHS from the people in order to use it as a vote generator. They are willfully ignoring the fact that the NHS should not be about politics, but about people. The people that work in it, but most importantly, ladies and gentlemen, the people that use it. The British people care deeply for the NHS. It's an institution that they hold close to their hearts. And because of this, the mainstream political parties have used it as a weapon which can inflict maximum damage on their political rivals. So at the moment, if you ask people about their experiences of the NHS, pregnant women and new mums will tell you that they're not getting what they need from maternity wards. The elderly will tell you that they're in hospital for far too long because there's no care plan in place for them at home. People with mental health problems will tell you they feel ignored and let down by the current system. Those visiting accident and emergency will tell you they have to wait longer than ever before to be seen. And those who have tried to get a GP's appointment recently will tell you it's a difficult experience, almost a battle, at a time when they're least able to fight. Now, UKIP, the People's Army, have asked the people what they want the NHS to be. Now, I'm talking about real people like you, not Westminster focus groups. And so, as a result, UKIP's health policy will be rooted around 4 key principles. There must be an unwavering focus on patient care and patient outcomes, and they must always come first in any decision-making. The NHS will remain free at the point of delivery and of need for all British citizens and qualifying foreign nationals. UKIP pledges an additional £3 billion more for the NHS every year. An affordable sum, made payable ultimately by the savings we will make from leaving the European Union, but in the shorter term, from savings that will be identified in our forthcoming manifesto. We'll insist that this money goes into frontline services, so that's doctors, nurses and care, not middle management or expensive spin doctors. UKIP is committed to tackling PFI debt, excess bureaucracy, wasteful spending and the abuses of NHS treatment. The taxpayer should not be paying for these failures. So we're going to confront these challenges to release even more funds into frontline services. So let me tell you what this is going to mean in practice. First of all, we will spend that £3 billion on the NHS, and that's going to mean 20,000 new nurses, 3,000 new midwives, 8,000 new GPs. We're going to invest in training, in research, in equipment. Now, I don't know about you folks, but I think that's a far better way to spend our money than giving it to the out-of-touch, members-only EU club whose own financial profligacy hasn't seen its own account signed off for the past 19 years. We'll invest funds into training more GPs, and will encourage those who have left the profession to come back into the surgery. And we're particularly keen to encourage the 40% of women who leave the profession early to get back into the surgery and practicing with patients. To cut GP waiting times, UKIP will free GPs from the burden of unnecessary data collection, target chasing, revalidation and appraisal work. This actively prevents them from engaging with patients. So these measures will ensure that GPs can meet UKIP's requirements to open surgeries at least one night a week and one weekend a month in order to meet demand. But there's one area that still isn't spoken about enough, probably because the sufferers feel too ill and too vulnerable to make their voices heard because they're not getting what they need from the NHS, and that is mental health. The health of our nation it's not just about our physical well-being, but about our mental well-being too. So UKIP will increase funding for mental health services to improve and speed up access to treatment for both adults and children. We will ensure that there is capacity for all pregnant women and young mums of children under the age of 12 months to have access to specialist health treatment. And we'll make sure that our clinicians take a whole person approach to physical and mental health. And then, of course, there is the huge issue of dementia. Dementia is the biggest killer of women over the age of 55. It is the third biggest killer of men. And yet this condition, research into this condition, is woefully underfunded. UKIP will ensure that researchers receive the resources they require in order to tackle this disease effectively. We will pledge £130 million per year to dementia funding. That is £650 million over the term of the next Parliament, double that recently pledged by the Tories. Additionally, we're going to stop outright wastage and bad management. We'll stop up to £2 billion being lost to the NHS every year through health tourism. Foreign nationals who come to Britain specifically to get free NHS treatment or prescriptions, or who don't pay their bills, or who are living here illegally or temporarily. We will cut this by insisting that migrants, students and visitors to Britain must have approved medical insurance. It's not fair, ladies and gentlemen, to expect the British taxpayer to pay for foreign nationals to use the NHS. This is Britain. It's the NHS, the National Health Service, not the International Health Service. UKIP will not give NHS numbers to overseas visitors. Only once they have contributed through taxation for 5 years will their requirement for insurance cease. We'll spend £200 million of the £2 billion saved from health tourism to end a shocking tax on the sick and vulnerable, UKIP will abolish car parking charges in our hospitals across England. Now, we have seen of late appalling scandals, haven't we, ladies and gentlemen, and cover-ups in some hospitals. There have been inexcusable failings of care that have claimed lives and caused immense heartbreak. Now, often, management failures, as well as clinical shortcomings, are to contribute to these scandals. And so, UKIP proposes that NHS managers should be subject to the same strict discipline as our doctors are via the GMC and our nurses are via the Nursing and Midwifery Council. Under UKIP, NHS managers must have a licence to manage as a statutory requirement. Yes. Removal of this licence will prevent incompetent, bullying or negligent managers being conveniently moved sideways or re-employed as NHS external consultants. Thirdly, we're going to make sure it runs properly. Last year, more than 1 million hospital bed days were lost because patients could not be discharged from hospital back home because there was nothing in place to meet their needs when they got there. They were unable to leave hospital because there was insufficient help for them or because there was nowhere to send them for long-term care. And this is one of the most shameful aspects of our failed health and social care policy. It really is. Because, ladies and gentlemen, it's the elderly, mainly in this country, who need help in their day-to-day lives, help to get out of bed, to get dressed and washed, feed themselves, overcome isolation during the day, and then getting back to bed in the evening. So how long do you think we provide a carer for an elderly gentleman with dementia? To make him his lunch, to feed it to him, to organise his medication, make sure that he's going to be okay for the rest of the day. How long do we give them, folks? 15 minutes per visit. 15 minutes. That is an absolute disgrace. This is a symptom. That is a symptom of the disconnect between health and social care funding. The NHS looks after the clinical need, but has no accountability for what happens when that person returns home. And likewise, the local council, responsible for the welfare of people within the home, but they're quite happy for people to languish in hospital. The council are content to see that person languishing because it means they don't have to pay. So charities have stepped in. Charities have stepped in and made a huge difference for many people in need of care. And UKIP will continue to work closely and supportively with the third sector. But it's wrong. It's wrong to expect charities to take on work that should be funded by the government, just because the government has decided to cut funding for vital services. So people... We all give money. The British people are so generous, so generous. People give money to charity in order to make people's lives better. They don't give money to charity in order to allow politicians to dodge their care obligations. So, if we want the elderly to feel the respect that we have for their efforts that they have made in their lives for us, if we want to be able to look in the eye and be able to say that they will get the care they deserve, we have to fund this area properly. So UKIP will integrate health and social care, bringing back both under the control of the NHS, merged into one social care fund. Now, integrating health and social care will also make a big difference to the intolerable pressure placed upon accident and emergency departments. If hospitals can't discharge people, then there's going to be no room for hospitals to admit people. Hospitals are declaring major incidents, not because there's been a major incident involving significant numbers of people, but simply because they can no longer cope with the number of patients. Meanwhile, hundreds of urgent operations are being cancelled. Often, the abuse of the 999 emergency service or patients turning up at A&E when they really should be visiting their GP adds to the pressure on our emergency departments. Now, clearly, an awareness programme will help prevent patients accessing A&E services inappropriately. However, we doubt this is going to go away completely, so we have come up with a common sense approach. We will initiate programmes in English hospitals to put at least one GP on duty in every A&E department during the week and provide additional weekend cover to ease the burden on A&E staff. If the pilot works, we can roll it out across the country, a common sense solution. Finally, there's so much that we can do to bring care back to the top of the agenda. UKIP expects home care agencies to pay the minimum wage to their staff and to pay them whilst they're on duty and in training. There's no excuse for a care company to hire anyone on a 0 hours contract. Care workers, they provide a lifeline to some of the most vulnerable people in our society. And in our new health and social care model, we will not allow the NHS to hire them on that basis. The NHS must set an example in all it does, and that includes ensuring that pay and conditions are fair for employees and contractors. Now, UKIP will also deal with the problem of elderly abuse. The Care Quality Commission, the organisation that's supposed to scrutinise the care for the elderly and put right any wrongs, just isn't working. One home care whistleblower told me that the media have closed down more abusive old people's homes than the CQC. We in UKIP will scrap the CQC. It will be abolished, and its remit will be brought back into our local county health boards. They will have the power to do unannounced spot checks and take evidence from whistleblowers. The same boards will be tasked with a statutory duty to take evidence from them, protect them, and help and support the families of victims of this elder abuse. To achieve the highest possible quality of care, we must have the right policies in place for nursing. So although the NHS is the biggest employer in the world, well, virtually, actually I think it's the 5th biggest employer in the world. It's the biggest employer in the UK. It still doesn't have enough nurses, folks. We're still short of nurses. UKIP would address the imbalance of there being too many managers and not enough frontline staff. We're going to simplify procedures for clinicians and nurses returning back to work within the NHS. Nurse training should take place on the ward, not in a university lecture theatre. It's true. There is a desperate need to bring care and compassion back to the heart of nursing, to negate the too posh to wash culture of some graduates, to make sure that patients never again die on our wards because their basic needs to be fed, given something to drink, and to be kept warm and comfortable are not being met. UKIP will bring back the state-enrolled nurse. Yes, thank you. Training will take place on the wards, utilising the current pool of auxiliary staff, allowing them to work towards becoming a state-registered nurse. Nurse managers will be responsible for ward cleanliness, the efficient operations of the wards, and oversight of nurse training. And UKIP will also insist that any foreign health professionals working in health and social care must hold appropriate qualifications and speak and write English to a level that is acceptable to the profession. Thank you. Our set of NHS policies are based on the experiences, needs and desires of real people that work and live outside the Westminster bubble. For these people, the NHS is vital. UKIP will not play politics with the People's Health Service. We are the only party that have ruled out entering into a coalition, so we are the only party that British people can be sure will fight after the election for the policies we have offered the public before the election. We are offering the country an NHS you tell us you want, an NHS you tell us you need, an NHS you will be happy dedicating some of your working day to support. Fair, fully functioning. It's an NHS that only UKIP will deliver. We believe in Britain. We believe in the NHS. Thank you, ladies and gentlemen.